Did you know that some people have a hard time recognizing angry or sad facial expressions? A study done with 16 to 21-year-old males who had conduct disorder and those who didn't found that the individuals with conduct disorder had reduced brain response when differentiating between neutral and angry faces. And when looking at sad faces, they showed an abnormal amygdala response.
But wait, if I can't recognize angry or sad emotions, does that mean I have conduct disorder?
Well, not quite. Actually, there's more to conduct disorder than just recognizing faces. So let's take a look. Let's follow our two friends, Pablo, who's 10 years old, and Lucas, who's 12 years old, to learn more about conduct disorder. In the DSM-5, conduct disorder is defined as a repetitive and persistent pattern of behavior where the basic rights of others or major age-appropriate societal norms are violated. For someone to be diagnosed with conduct disorder, they need to meet the following requirements. Show at least 3 of the 15 criteria in the past year, and one of these criteria should be present in the past 6 months. Their disturbance in behavior has to cause clinically significant impairment in their social, academic, or occupational functioning. Lastly, if they are older than 18, they cannot have met the criteria for antisocial personality disorder. Criteria for conduct disorder fall into these 4 categories: aggression to people or animals, destruction of property, deceitfulness or theft, and serious violation of rules. Let's look at Lucas. He's been showing the following symptoms for the past 3 years. Lucas is entertained when he hurts his dog or makes it cry. He finds it fun to provoke other kids and starts fights for no reason, and his parents have been receiving many complaints from his teachers about his disruptive and aggressive behavior. He often steals from other people and likes to destroy the belongings of others, causing other kids to be afraid of him. Lucas has persistently and continuously shown at least 3 symptoms for more than 1 year, so he was diagnosed with conduct disorder. Now, let's take a look at Pablo. He sometimes forgets to feed the cat even though his dad tells him to. He recently stole $5 from his dad's wallet to buy ice cream, but got scolded and understood what he did was wrong and has never done it since. While Pablo sometimes misbehaves, his behaviors are not consistent with the criteria, and so he was not diagnosed with conduct disorder. Depending on the severity of a child's symptoms, we can rank the severity of conduct disorder in the 3 categories: mild, intermediate, and severe. Furthermore, individuals with conduct disorder can also fall under one of these 3 subtypes: childhood onset, where they show at least 1 conduct problem before 10 years old; adolescent onset, where they have no conduct problems before 10 years old; or unspecified, where the time of onset is unknown. Lucas began showing symptoms when he was 9 years old. What type of subtype does he have?
I think Lucas has childhood onset conduct disorder.
Yes, that's right. Research has also found that children with childhood onset conduct disorder are more at risk to develop ADHD and anxiety disorders later in their lives, whereas children with adolescent onset conduct disorder are more at risk of PTSD and alcohol and substance use disorders.
Okay, I think I understand what conduct disorder is now. Is it common?
Well, 3% of school-aged children have conduct disorder.
So, what are some reasons that may have contributed to Lucas having developed conduct disorder?
There are a multitude of factors and mechanisms that can lead to the progression of conduct disorder. Twin studies have found that 50% of the variance in conduct disorder is actually associated with environmental influences. Let's look into these more. Prenatal mechanisms are well studied in relationship to conduct disorder. These occur when the child is being carried by the maternal parent and would include factors such as maternal smoking, alcohol use, drug use, and stress during pregnancy. There is some research that suggests that stress during pregnancy can actually affect the development of the child's prefrontal cortex. This is a part of the brain involved in a lot of decision making. There are a few perinatal factors as well. which are factors associated with the time immediately before or after birth. These factors could include parental psychopathology, malnutrition, exposure to heavy metals, and birth complications. Studies have found that malnutrition during pregnancy can lead to changes in various neurotransmitter functions in the brain. Neurotransmitters are essentially signaling molecules in your brain. There are also a few other environmental factors to consider. These would include harsh parenting, parent-to-child conflicts, low socioeconomic status, and community violence. Other studies have also found that 27% of children with conduct disorder have actually been affected by sustained childhood trauma and abuse.
Wait a second, you mentioned something about brain structure in the beginning, right?
Yes, you're right. Studies done in children with conduct disorder have also found a few abnormalities in brain structure. A majority of these brain regions are involved in emotion regulation and recognition, empathy, and reward processing. Researchers found a lower activation of the dorsal and rostral anterior cingulate cortex, or the ACC, the medial prefrontal cortex, and the ventral striatum when comparing children with conduct disorder to those without. These regions of the brain are involved in cognition, attention, control, mood, and learning. Do you remember that study mentioned at the beginning of this video? Well, other studies have also found abnormal amygdala functioning, which can be related to increases in aggression. This is because the amygdala is responsible for processing fearful and threatening stimuli in the environment. Other areas affected in the brain are some involved in moral decision-making, face processing, and motor functions.
Ah, okay, that makes more sense now. This disorder is way more complex than I thought. Is there anything a parent can do to help their child experiencing conduct disorder?
For sure. In terms of management and treatment, there are a few options depending on the subtype of conduct disorder. For example, early intervention can include treatments focusing on the quality of parenting and behavioral parent training, whereas cognitive behavioral therapy can be used later in adolescence. Your doctor may also prescribe medication to help alleviate some, but not all, symptoms. However, stay tuned on the channel as there will be more videos about this in the future. And be sure to check the description box for more resources in the meantime. So let's take a look back at our two friends. Though Pablo does misbehave and his parents might complain that he's a naughty child, he knows where his actions goes wrong and understands not to do them again. However, if you remember Lucas, he doesn't necessarily think the same. His mother often tells him that his actions have severe consequences, but he continues to do them again and again. Simply put, conduct disorder is more complex than just misbehaving. We hope you've been able to understand more about Lucas and why he was diagnosed with conduct disorder and why Pablo was not.